Vessels of the upper limb. Vessels of upper limb. Vessels means artery and vein. So let us start with veins first. There are two important superficial veins you have already seen. That is basilic vein and cephalic vein. Basilic and cephalic vein. Two important superficial veins of the upper limb. Now, which one lies laterally and which one lies medially? Cephalic vein lies laterally. Cephalic vein lies laterally, lateral aspect of the forearm, and basilic vein lies medially. This cephalic vein starts from where? Cephalic vein starts from where? Cephalic vein starts from dorsal venous arch. Dorsal venous arch lies on the dorsum of the hand. Dorsal venous arch lies on the dorsal aspect of the dorsal aspect of the hand. Now, medial end, dorsal venous arch. Dorsal venous arch is formed by veins arising from the digit. So it is called dorsal digital vein. When it is arising from digit, then it is a digital vein. As it is on the dorsal aspect, so dorsal digital vein. Dorsal digital vein, when they will anastomose with each other, they will form dorsal venous arch. This is the dorsal venous arch. From its lateral aspect arises cephalic vein. Now you have to describe the course of the cephalic vein. Cephalic vein, after arising from the dorsum, it will pass over the anatomical snub box. This depression is known snub box. This depression is known as snub box. We have to know the boundary of the anatomical snub box. Later on you should know it. Now just remember that is the anatomical snub box. So this vein will pass over the anatomical snub box. Then it will come to the front anterior aspect of the forearm. Now it will ascend like this. It will ascend on the front of the forearm, on the lateral aspect of the forearm, lying anteriorly. Then it will pass like this and it will enter in the clavipectoral fascia. You have already known the name of the clavipectoral fascia. Deltopectoral groove. Deltopectoral groove. It is a deltoid muscle and pectoralis muscle. It will pass along the deltopectoral groove, and after coming over here, it will pierce the clavipectoral fascia. I have already told you, and you are possibly have seen also the structures piercing the clavipectoral fascia. There are three important structures that pierce the clavipectoral fascia. Number one, lateral pectoral nerve. Number two, cephalic vein. Number three, thoracoacromial artery. So this is cephalic vein. After piercing the clavipectoral fascia, it will drain into the axillary vein. So this is the course and formation of the cephalic vein. Now come to the basilic vein. Basilic vein, it is the continuation of the medial end of the dorsal venous arch. It is the medial end of dorsal venous arch. Then it will, after arising from here, it will come in the frontal aspect of the forearm. Then it will pass anteriorly over the forearm, and at the middle of the arm, here it will pierce the deep fascia. Here it will pierce the deep fascia, and then it will accompany the brachial artery. And brachial artery, already you know, brachial artery has on either side two veins, that is called venipuncture. Brachial artery is accompanied by two veins, that is called venipuncture. Now, after reaching the lower border of the pectoralis major, this basilic vein will join with the venipuncture accompanying the brachial artery, and they will form the axillary vein. So axillary vein is actually formed by two accompanying veins of the brachial artery, that is vena comitantris, at the lower margin of the pectoralis, teres major muscle. Now, just at the beginning of this vein, this basilic vein will join the axillary vein, right? Now, these two veins, one important vein is from cephalic vein, one vein at the cubital fossa, it arises and joins the basilic vein. It arises just distal to the bend of the elbow from the cephalic vein, and then it passes across the elbow joint and it joins the basilic vein just proximal to the elbow joint. This is known as median cubital vein. Suppose this is the cephalic vein. This is the basilic vein. This vein will be like this. This is median cubital vein. This median cubital vein actually lies superficial to one important aponeurosis that is known as bicipital aponeurosis. So it lies superficial to the bicipital aponeurosis, and it is connected to the deeper vein which lies deep to the bicipital aponeurosis by two perforating veins. So here there are two perforating veins. Actually, it connects the deep vein, and this perforating vein is passing through the bicipital aponeurosis. Then what will happen? This bicipital vein will be fixed. It will not move. And what is the advantage of this? Because of this, as this vein does not actually move, so it is very easy to take blood from this vein. So it is very easy for venipuncture. Venipuncture, or if you want to give some saline through the vein, this vein generally first choice is this vein, because this vein does not move. So this is a median cubital vein. Sometimes it may come as a short note. So first of all, you have to tell how it is formed, what is its advantage, all you have to describe. Now come to the artery. Now, artery of the upper extremity. Upper extremity artery actually is coming from which artery? Axillary artery. Axillary artery. Now, axillary artery is coming from where? Axillary artery is the branch of decision দেখেছিস তো? Axillary is coming from where? It is the continuation of subclavian artery. It is the continuation of the subclavian artery beyond the outer margin of the first rib. Suppose this is the first rib. This is first rib.
This is teres major muscle. Teres major muscle. It is pectoralis minor.
Actually, this diagram is actually schematic diagram. It is not actual diagram, it is schematic diagram for your understanding. Now, here you see, this artery is the axillary artery. Here it was subclavian artery. After crossing this border, it is known as axillary artery. This axillary artery extends up to this. After the lower margin of the teres major, it will be known as brachial artery. It will be known as brachial artery. Now this axillary artery, now you have to know the parts of the axillary artery. This axillary artery is divided into three parts. First parts from the outer border to the upper margin of the pectoralis minor. This is the first part, and deep to pectoralis minor is the second part, and from the lower margin of the pectoralis minor up to the upper margin of the teres major is the third part. You know, first part gives off one branch, second part gives off two branches, and third part gives off three branches. First part gives off one branch, that is superior thoracic artery. Superior thoracic artery. Here it will give superior thoracic artery. Superior thoracic artery. This artery will give up branches first and second intercostal space. It will give branches to intercostal space first and second. Now, this part, here it gives up two branches. One is thoracoacromial artery, thoracoacromial artery, thoracoacromial artery, and lateral thoracic artery, and lateral thoracic artery. Though I drew it because if it is under cover of this muscle, it will not be visible to you. That's why I draw it outside. But actually it will be inside, deep to it. Deep to it. Now, this thoracoacromial artery, and lateral thoracic artery. Lateral thoracic artery. Lateral thoracic artery. Actually, this artery passes along the lower margin of the pectoralis minor muscle, and it comes to the thorax. And it gives a major supply to the breast in case of female. And thoracoacromial artery, you know, it will pierce the clavipectoral fossa and it will be divided into several branches. One branch is clavicular branch, one is pectoral branch, one is called deltoid branch, and one called acromial branch. There are 4 branches it gives off. Now come to the third part. Third part gives off 3 branches. One is subscapular branch, one is anterior humeral circumflex, and another is posterior humeral circumflex. It is anterior and this one is posterior, and this one is subscapular artery. Subscapular artery. Subscapular artery. Anterior humeral circumflex. And this one is the posterior humeral circumflex. Posterior humeral circumflex artery actually accompanies the axillary nerve, and you know axillary nerve lies along the posterior aspect of the surgical neck of the humerus. So if you surgical neck of the humerus there is fracture, so this posterior circumhumeral artery may be fractured also. Suppose you are going along the street, someone sustained injury, lacerated injury on the forearm, and there is severe bleeding. Spotting bleeding means when you see the blood is spotting, that means it is coming from artery. So here, as it is near the wrist joint, so it must be the branches of the radial or ulnar artery. Now, as a doctor, you have some role to play there. How will you stop? How will you stop this spotting? কি করে স্পটিংটা থামাবি? Suppose you are passing along the street, some traveler fall over the street. There is lacerated injury on the anterior aspect of the forearm. So there is severe bleeding, spotting blood bleeding. So as a doctor, what role will you play? Will go forward for help, and how will you stop? এরকম করে তো সবাই ধরবে, এরকম সবাই বাঁধবে। যারা লোকাল যে সমস্ত পিপুল থাকে তারা তো এখানে বাঁধবেই, তো এরা তো লোকাল পিপুল তো করবে, এরকম হবে, এখানে বেঁধে দেবে। এটা তো ডাক্তার না, ডাক্তার এটা তো জানতে হবে। You have, in this way you will not be able to stop. এখানে বেঁধে তো স্টপ করতে পারবি না। তো where will you press the artery? You know this is the branch of the brachial artery, and brachial artery is most superficial near the elbow joint. Just above here, you can feel the pulse of the brachial artery, and when you will record your blood pressure, you generally place the chest piece over that artery. So here it is most superficial. So here you will press. At the moment here you will press, the blood will stop. তখন লোকেদের ভিতরে অ্যাপ্রিসিয়েট জানে, এটা খুব ভালো লোক, তো কি ভালো জানোতে কোথায় চাপ দিতে হয়। হ্যাঁ, কেন জানা যে তুই অ্যানাটমি জানিস, হ্যাঁ, তোর তো এখানে অ্যানাটমিক্যাল নলেজের কাজে লাগাতে হবে। ইউ হ্যাভ টু স্টপ হিয়ার। হ্যাঁ, নাও কাম টু দ্য these are the branches. So out of these branches, this is known as subscapular branches. As this artery passes over the subscapular muscle, subscapularis muscle, and in the exam you may be asked to identify this branch, and in your cadaver you will see this branch. This branch actually accompanies one important nerve, that is thoracodorsal nerve. Thoracodorsal nerve also accompanies the subscapular artery. So the lower part of this artery is also known as thoracoacromial artery. Subscapular artery at its lower part it is accompanied by thoracodorsal nerve, so that part also known as thoracodorsal artery, but it is actually the subscapular artery. Right. Now come to the brachial artery. You have to know all the artery of the upper limb. Now come to the brachial artery. Brachial artery, you know the course of the brachial artery. It starts from the lower border of the teres minor and it will end where? Here, at the elbow joint, there is radius, neck of the radius. At the level of the neck of the radius, at the cubital fossa, it will divide into two terminal branches. One is radial artery and another is ulnar artery. Ulnar artery. Here, you should know the relations. At the cubital fossa, you know the relation. Mnemonics 10. Tendon, artery and nerve from lateral to medial. This is the tendon of the biceps brachii. So first you will get the tendon of the biceps brachii. Just medial to it, artery, that is brachial artery, and then nerve, that is median nerve. There are three important structures at the cubital fossa. So here it is the just lateral to the nerve. But it is the lower part. But at the upper part, this artery is related to median nerve. But here median nerve lies medially. But at the upper part, the median nerve lies laterally. At the upper part, the median nerve lies laterally, and at the lower part, the median nerve lies medially. So this is the relation of the medial nerve and brachial artery, right? So this is the brachial artery. Now brachial artery, you should also, if it comes as a short note of, then you should also mention on which structure it is descending. Actually, it descends on the above. It descends on the long head of the triceps. Then it descends over the medial head of the triceps. Then it crosses over the coracobrachialis. Then it crosses over the brachialis muscles. So all these muscles, over all these muscles, it is descending. It is mention করতে হবে আর কি যদি পারিস আচ্ছা now after coming over here it will divide into two, that is two branches, terminal branches, that is radial artery and ulnar artery. This radial and ulnar artery, time কত আছে দেখে গেল। Now I am going the two important arch, superficial and deep palmar arch and superficial palmar arch. These two palmar arch is very important, short note as well as surface marking. So I am skipping that part. I am coming directly on the palm. Now on the palm you will get two palmar arch, arterial arch. One is superficial palmar arch and one is deep palmar arch. Superficial palmar arch I am drawing first ulnar artery. Ulnar artery, you know, ulnar artery passes over the flexor retinaculum. It passes superficial to flexor retinaculum. What is flexor retinaculum? Flexor retinaculum key. It is the condensation of deep fascia of the forearm. Deep fascia of the forearm has been condensed here to form flexor retinaculum. It is the flexor aspect, flexor retinaculum. পেছনে বলতে আমরা dorsal retinaculum. তাহলে it passes over the flexor retinaculum. Now this is the ulnar artery.
Ulnar artery.
Ulnar artery passes lateral to the pisiform bone. It is the lateral aspect, it is the medial aspect, so it is passes lateral aspect. Now, it gives off two branches, one superficial branch, one deep branch. Superficial branch will pass just below the hook of the hamate. This is the hook of the hamate.
I am drawing superficial branch. This is the superficial branch. It is passed below the hook of the hamate.
It is the hook of the hamate below. Actually, this superficial branch is the main continuation of the ulnar artery. Now, this superficial branch will join the superficial branch of the radial artery. Radial artery comes from the radial aspect. It is a radial aspect.
So this is the radial artery, superficial branch of the radial artery,
and these two will meet to form the superficial palmar arch. তাহলে যদি বলে superficial palmar arch is formed by, আগে প্রথমে লিখতে হবে superficial palmar arch. Superficial palmar arch is formed by medial 2/3 contribution by ulnar artery, superficial branch of the ulnar artery, and lateral 1/3 is contributed by the superficial branch of the radial artery. And these two branches will form meet and form a arch. আর্চটা এরকম হবে,
আর্চ মানে এরকম আর কি, একটু কনভেক্সিটি থাকবে। আমার এটা কনভেক্সিটি হয়নি, একটু কনভেক্স হবে আর কি,
বুঝতে পারলি? আর্চ, দ্যাট ইজ superficial palmar arch. Now, sometimes this branch, this lateral aspect is contributed, lateral third is contributed by superficial branch of the radial artery. Sometimes another two artery may contribute instead of superficial branch. তার কারণ এখানে this radial artery here gives of two branches. One is known as arteria princeps. One branch is arteria princeps, and one is known as arteria radialis indicis. Arteria radialis indicis.
এটা হচ্ছে arteria radialis indicis. And as it is passing to the index finger, and it is going to the thumb, it is arteria princeps. Arteria princeps.
Sometimes this artery may contribute to the formation of the superficial palmar arch. Sometimes this branch also may contribute to the formation of the deep arch. তাহলে তিন ভাবে হতে পারে, একটা সুপারফিশিয়াল ব্রাঞ্চ, আবার সামটাইমস ব্রাঞ্চ অফ দ্য ব্রাঞ্চ, মানে এর ব্রাঞ্চ, যাকে একটা সুপারফিশিয়াল এর ব্রাঞ্চ, দে অলসো মে কন্ট্রিবিউট টু দ্য ফর্মেশন অফ দ্য আর্চ। বুঝতে পারলি? তাহলে এত জটিলতে না গিয়ে বলে দিবি যে সুপারফিশিয়াল পামার আর্চ ইজ কন্ট্রিবিউটেড বাই, এই মুদ্রা কথাতে বলে মনে রাখবি, সুপারফিশিয়াল পামার আর্চ ইজ ফর্মড বাই সুপারফিশিয়াল ব্রাঞ্চ অফ দ্য আলনার আর্টারি অ্যান্ড সুপারফিশিয়াল ব্রাঞ্চ অফ দ্য রেডিয়াল আর্টারি। ওইটুকু মনে রাখবি আপাতত, ঠিক আছে? আর যদি বেশি মনে রাখতে চেষ্টা করি তাহলে এগুলো বলবি। Now from this arch it will give some branches. কি কি ব্রাঞ্চ দেবে? এইখান থেকে আর্টারি যখন হলো কি কি it will give off what type of branches? One branch it will give off, that is will pass along the লিটল ফিঙ্গার। এটার নাম হচ্ছে লিটল ফিঙ্গার, ওটার নাম ডিজিট। এটার নাম হচ্ছে প্রপার ডিজিটাল ব্রাঞ্চ। এটাকে নাম বলবো প্রপার ডিজিটাল ব্রাঞ্চ। এটা হচ্ছে প্রপার ডিজিটাল ব্রাঞ্চ, প্রপার ডিজিটাল ব্রাঞ্চ। তাহলে একটা দিল প্রপার ডিজিটাল ব্রাঞ্চ উইজ গোয়িং টুয়ার্ডস দ্য মিডিয়াল অ্যাসপেক্ট অফ দ্য লিটল ফিঙ্গার। এবার আর একটা দিবে ব্রাঞ্চ, সেটা যাবে এখানে, এই মাঝে দুটো আঙুলের মাঝে। এটা হচ্ছে কমন, এটা হচ্ছে কমন ডিজিটাল ব্রাঞ্চ। এখানে দিল, আবার এখানে দিবে কমন ডিজিটাল ব্রাঞ্চ, এখানে দিল কমন ডিজিটাল ব্রাঞ্চ। এগুলো হচ্ছে কমন ডিজিটাল ব্রাঞ্চ। It will pass the wave space between little and ring and middle and index. এই তিনটাতে দিল কমন ডিজিটাল ব্রাঞ্চ। এবার কমনটা আবার ভেঙে গিয়ে they will form, এইগুলো আবার on either side of the digit এরকম ভাবে যাবে আর কি, এরকম ভাবে যাবে, বুঝলি তো? এই তাহলে কমন ডিজিটাল ব্রাঞ্চ will divide into proper digital branch. এখানে ডাইরেক্ট একটা proper digital branch, it gives a proper digital branch, but here there are three common digital branch. That common digital branch again divide near the wave space and will give up the proper digital branch. Are already these two is the given off by the radial artery. একটা হচ্ছে arteria princeps, আর একটা arteria radialis indicis towards index finger. So these are the branches from the superficial palmar arch. বুঝতে পারলি? Now why it is called superficial? Sometimes you may be asked why you are calling it superficial palmar arch. There is another palmar arch, deep palmar arch, and this one is superficial palmar arch. As it lies superficial to what? You may be asked, superficial to what? Superficial to long flexor tendon. এখানে যে টেন্ডন গুলো আছে সব টেন্ডন গুলো দেখতে হবে, টেন্ডন। ফ্লেক্সর ডিজিটাম সুপারফিশিয়ালিস, ফ্লেক্সর ডিজিটাম প্রফান্ডাস, যে টেন্ডন গুলো আছে ফ্লেক্সর টেন্ডন, it lies superficial to the flexor tendons and deep to the palmar aponeurosis. Palmar aponeurosis টা কি? It is the deep fascia of the palm. তাহলে it lies deep to the palmar aponeurosis and superficial to the long flexor tendons. That's why it is called superficial palmar arch. And deep palmar arch কাকে বলবো? Which will lie deep to the long flexor tendons. তাহলে আমাদের একটু পরে এবার আমরা ডিপ পামার আর্চটা বলবো। তাহলে ওইটা বলি ডিপ পামার আর্চ লাই ডিপ টু দা ফ্লেক্সর টেন্ডনস, রাইট? Now, here I am just superficially touching all points, but you have to study in details. হ্যাঁ, তো ভাবি না আমি একবার নোট দিয়ে দিলাম ওইটা পড়বো আর সে কমিটেড টু মেমোরি অ্যান্ড ভমিটেড টু দ্য পেপার, তাহলে হবে না। হ্যাঁ, বাড়ি গিয়ে আমার তো পড়তে হবে, তো শুধু বুঝে যা আর কি। হ্যাঁ, কনসেপ্টগুলো বুঝে যাবে আর কি।